Well, howdy folks. Here's a little something to make your eyebrows shoot up. A recent study, presented at the annual conference of the American College of Chest Physicians, has revealed that marijuana consumers who contracted COVID-19 had lower rates of intubation, respiratory failure, and death compared to non-users. Now ain't that a hoot? Researchers got their hands dirty with records from over 322,000 patients. And get this, less than 1% reported consuming cannabis. Now, that's a needle in a haystack if I've ever seen one. As it turns out, cannabis consumers were generally younger and had higher rates of tobacco use. On the flip side, non-users had higher rates of other comorbidities. But here's where things get interesting. Marijuana users had significantly lower rates of intubation, acute respiratory distress syndrome, acute respiratory failure, severe sepsis with multi-organ failure, in-hospital cardiac arrest, and mortality. To back this up, a one-to-one matching analysis confirmed that cannabis consumers had lower rates of health complications related to COVID-19. Now, that's some food for thought, ain't it? But before anyone starts lighting up in celebration, it's important to note that there's still a significant gap in understanding the impact of marijuana use on COVID-19. Previous studies have shown mixed results, with some suggesting a lower chance of COVID-19 infection, but more serious infections among cannabis users. In a lab study, certain cannabinoids were found to potentially prevent COVID-19 from entering human cells. However, this study did not assess marijuana smoking by patients themselves. And let's not forget, tobacco smoking is considered an additional health risk for COVID-19. So, what does all this mean? Well, the study's findings suggest that marijuana use may have some protective effects against COVID-19. However, more research is needed to fully understand these effects and their implications. In summary, this study has revealed a fascinating correlation between marijuana use and COVID-19 outcomes. But remember, correlation doesn't always mean causation. So until we have more concrete evidence, it's best to stay safe, follow the guidelines, and keep those masks handy, folks. Stay curious, stay informed, and until next time, y'all take care now. Join our stoner community group on Facebook, Hippie Stoners.